according to the TCGA data, usually head and neck squamous cell carcinoma presents with a very large mutation burden. And it is related to a high immunogenicity. But on the other side, there are too many signals in the microenvironment of these cancers that cause an immune tolerance to these cancer cells. For example, a decreased expression and secretion of interferon gamma. We have a decreased expression of surface molecules related to T cells activation, like CD137 and OX40, and an increased expression of some molecules related to energy of these T cells, like PD-L1 and PD-1. We had a presentation in the last ASCO annual meeting held in Chicago this year, where Dr. Sievert presented the data of Keynote 12 trial, and in fact it was presented an expansion cohort of more than 130 patients, and they were all treated with pembrolizumab, 200 milligrams every 3 weeks. Pembrolizumab is an antibody directed to PD-1, and in this trial they detect a response rate of 25%, and 56% of these patients presented some kind of decrease in measurable lesions. And most interestingly, in those patients with responding tumors, the duration of response was not yet reached. In general, this treatment was well tolerated, and I would like to stress that globally there is another clinical trials investigating these agents, and one of them is the trial called Keynote 48, in which those patients with recurrent or metastatic head and neck squamous cell carcinoma, they were not amenable to be treated with radiation or surgery, and they will be randomized in 3 arms. The first arm, pembrolizumab alone. The second arm, pembrolizumab plus chemotherapy, platinum and fluorouracil. And the third arm, the reference regimen called as extreme, cetuximab plus platinum fluorouracil. And I think that we need to collaborate with these trials in order to better characterize what are those patients who can most benefit of these drugs. And because, for example, we don't know yet the correct dose, correct regimen, the toxicity profile, and we need to develop some biomarkers related to response, and in order to develop, for example, some cost effectiveness data.